How does antibiotic use in farming cause resistance? Have you ever wondered how the antibiotics used in farming can affect our health? Let's break down this important issue. Antibiotic use in farming is a significant factor in the rise of antibiotic resistance. When antibiotics are given to farm animals, it exposes bacteria to these drugs. This exposure creates a situation where only the bacteria that can survive the antibiotics thrive. Farmers often use antibiotics for various reasons, including promoting growth, preventing disease, or treating infections. When these drugs are administered regularly, they kill off the bacteria that are sensitive to them. However, the resistant bacteria remains and multiply. Over time, these resistant strains become the dominant bacteria in the animal's gut. The problem doesn't stop there. These resistant bacteria can spread to humans in several ways. One common route is through direct contact between farm workers and animals. If a worker handles an animal treated with antibiotics, they may come into contact with resistant bacteria. Another way is through the food we eat. Consuming contaminated meat, milk, or eggs can introduce these resistant bacteria into our bodies. Even water can be a source if it becomes contaminated with animal waste. Additionally, resistant bacteria can transfer their resistance genes to human pathogens. This process is known as lateral gene transfer. When this happens, it makes treating infections in humans more difficult because the pathogens gain resistance traits that were originally selected in farm environments. The extent of antibiotic resistance is closely linked to how much and how often antibiotics are used in farming. High usage, especially of antibiotics that are important for treating human infections, raises the risk of developing resistance. Poor farming conditions, where infections spread easily among animals, also contribute to this issue. From the viewpoint of an infectious disease specialist, this situation is alarming. Infections caused by resistant bacteria can lead to treatment failures, increased illness, and higher healthcare costs. To combat antibiotic resistance, we need to use antibiotics wisely in both human medicine and agriculture. Improving infection control measures and monitoring resistance patterns are also essential steps. By being mindful of how antibiotics are used in farming, we can help protect public health and ensure that these important medications remain as effective for everyone.